Jacqueline, I'm going to be showing how to don and doff PPE. Before entering the patient's isolation room, you're going to perform hand hygiene. And then you're going to put on your gown first. You're going to tie around the neck. And then you're going to tie around the waist. First, you want to make sure that none of your undergarments are showing. Okay. Then you're going to put your mask on. You're going to want to make sure that this is tied around the nose and face. Then you're going to put on your clean gloves. You're going to want to make sure the glove is over the cuff of the sleeve. Okay, now you're safe to enter the patient room. Once you get done doing what you need to do in there, you're going to prepare to leave by taking your PPE off. So the first step is to take your gloves off, and you're going to pinch the middle of it and pull the glove. Then you're going to keep that glove inside this one. You're going to use 2 fingers to pull down. And then you're going to take off your gown. You're going to have the strings out. And then you are going to pull your mask off, and be careful not to touch your face as you do so. You're going to wad it up and throw it in a covered biohazard bag so it doesn't spread anything. Then you will perform some hand hygiene, and then you're all done.